Hi, my name is Jennifer Knight, and I'm going to discuss the sympathetic nervous system and the parasympathetic nervous system and how it relates to trauma and recovery. The SNS and the PNS both make up the autonomic nervous system, and each part responds to trauma, crisis, and disasters a little bit differently. They both prepare the body for fight, flight, freeze, or relaxation. The SNS is mostly active during and immediately after crisis moments. The SNS alerts the brain and the body to dangerous situations by triggering the fight, flight, or freeze response. The PNS nervous system activates through the vagus nerve once the SNS is exhausted and the person begins to give up or give in to their stressful circumstance. Then the PNS takes over, and at this time, the PNS begins to calm the body down, even if the stressor is still occurring. When the SNS is activated to protect an individual from danger, there are some physiological changes that occur in the body. And I've listed some here, and they probably are familiar, and they can be identified as increased heart rate, blood pressure, increased sweating, decreased digestion, dry mouth, butterflies in the stomach, dilated pupils, body hair standing on end, and goosebumps. And some of these physiological changes occur so that an individual can react in ways that they wouldn't normally react in order to protect themselves from harm. When the SNS reaches extinction and is exhausted of its resources, the PNS activates. And there are some physiological changes that occur in the body when the PNS begins to work. And I've listed some here, and they include deep breathing begins to occur, the heart rate slows down, blood pressure reduces, sweating starts to diminish, digestion begins to activate once again, and the muscles begin to relax. And the PNS allows for free flowing movement that is autonomous rather than reactive. In the next few slides, I'm going to share with you some empirically based theories that counselors may apply, some approaches and techniques that counselors may use when they are addressing survivors of trauma, disasters, or crisis. On this slide, I have listed some theoretical concepts that counselors may consider when they are helping individuals who have survived trauma or disaster. A humanistic theoretical approach would be appropriate because it focuses on self actualization of the individual and their own resiliency and their ability to grow and heal from trauma from their own volition. And this is a very logical theory that I think would be appropriate for survivors of trauma, and counselors could apply this theory to help them heal. Holistic theory is important. I hope that counselors would consider this theoretical concept because it considers all parts of an individual are connected and they're not separated. And so they should all be considered together when treating trauma. It's important to address the individual as a whole, their mental health, their emotional health, and their physical health. And to address one without the other would really be doing the individual a disservice. Mindfulness theory is really great and appropriate for individuals who have experienced trauma because it encourages individuals to remain in the present moment. it emphasizes present moment awareness. And in the present moment, the trauma is no longer occurring. So this could help the traumatized individual realize that they are in a safe place when the counselor reminds them to be mindful or practices mindfulness exercises with them shortly after a traumatic event. I think these theories would be really helpful when applying them to traumatized individuals. I'm sure there are other ones that would also be helpful, but these seem to stand out for individuals who have experienced trauma and are just trying to cope. In this slide, I have listed some approaches that I think would be useful for disaster and mental health counselors when they are entering the environment of a recently occurring disaster or crisis. I think counselors should have a non judgmental attitude when they're entering these kinds of spaces because there's nothing really to judge. It's important that we are fully helpful in every way, in every regard, and to not have an attitude that may be deterrent towards individuals who need help. It's important that counselors have a soothing demeanor because affected individuals have just experienced chaos. And it's really important that our presentation is not chaotic as well. I think it's important for disaster mental health counselors to be present and supportive to affected individuals from disasters and crisis because they need us, and it's important that we aren't distracted by the chaos that might be occurring or distracted by anything around us. It's important that we are present and are offering support when the individual is ready to receive it. And if we remain present and focused in making eye contact and being available for others, then it will be helpful for others to mirror that and also stay in the present moment. I think it's important that counselors are compassionate and empathetic when they approach individuals because they are responding to something that is not typical. It's very abnormal, and we don't know how it felt for them. And so it's important that we have compassion because we can't possibly know how difficult that experience was, and to be empathetic and validating to what has occurred for them. I think that cultural competence is very important for counselors that are helping at crisis and disaster sites because there could be a range of diverse individuals there, and due to their diversity, they will likely respond to the trauma and the disaster differently, and that's something that we can't predict. However, it would be important and helpful for disaster mental health counselors to educate themselves the best that they can so that they can respond with cultural competence to individuals in a way that resonates with their values and their worldviews and that they will relate to. A holistic approach is very important. As I was speaking about earlier, it's important that counselors consider the entire person, their psychological well being, their emotional well being, their physical state, because all of it is important as a whole. But however, one part might need more help than another area of the body, and so that would be where we should attend to first, but also making sure that all areas are being attended to and are integrated in a healing direction. The stop approach is a acronym that is helpful to counselors to remember so that they can help individuals cope. And stands for sit, uh, think, observe, and plan. I keep trying to memorize it. Stop, think, observe, and plan. Those are very important steps to take. And the solar approach is one in which the counselor projects their body language in such a way that it communicates openness, availability, and um, a non aggressive kind of stance. I think these are helpful for disaster mental health counselors, and I think there's likely more. On this slide, I have listed counselor techniques that have been effective when counselors have entered an environment that has been affected by a disaster or a crisis and they're interacting with the individuals who have been affected. Contact and engagement is an important technique. It involves the counselors responding to individuals who are asking for help. It's important that we are there and we engage with them when they need it, especially when they're asking for it, because that means they're ready. Providing safety and comfort. This is an important technique. Always, we want to be a very comforting presence for individuals who are not feeling comfortable. And stabilization is important. Counselors need to employ any stabilization technique that works for that individual to help them calm down from overwhelming situations that they have just experienced. And below, I've listed some stabilization techniques that will help individuals. Some may like it, and some may like another one over another. And so these techniques all are stabilization techniques: entrainment, bilateral stimulation, stress eraser, the lap tap, the shoulder tap, foot tap, the toe tap, palm calm, and safe place. There are quite a few of them, so I'm not going to explain all of them. I'll go too long, but these are some really important techniques that I think would be helpful. On this slide, I have listed a few outcome-based interventions that have been effective at helping individuals who have experienced crisis or disaster. The Critical Incident Stress Debriefing Program, it supports individuals who have survived a disaster and helps them mitigate the impact of the trauma. This program is valuable because it offers post-incident education, it offers individual and family counseling and follow-up counseling, and also referrals and resources. I listed neighbor helping neighbor as a theoretical intervention because it's very humanistic and logical, and it essentially states that survivors return to baseline faster when they receive support from their neighbors and their community members. And this makes a lot of sense. I think when the community comes together and helps one another, it develops stronger bonds within the community. I think that it makes the community as a whole stronger enough to rebuild and to recover together rather than doing it individually. And I think it fosters kindness and hope and love between individuals because they've survived the same crisis together. I think that this is real and that it's true, and I wish it was happening more often in communities and neighborhoods. FEMA Crisis Counseling and Training Program is a federally funded program, and it can be accessed for survivors 2 to 9 months after the disaster has occurred. And so, this program, I believe you need to apply and you may have to wait for services, but it does offer some really great benefits, similar to the CISD and education. Counseling sessions, group crisis counseling. It offers public education, which I think is great for larger areas or larger communities, and they offer resources, support, and community networking. I also thought that psychological first aid is a really great intervention strategy that produces beneficial outcomes immediately. It's an intervention strategy that is practical and it's easy to use, and it helps individuals reduce their stress levels. It increases short term and long term adaptation, and it also connects individuals with resources. And so that produces a really beneficial outcome on the spot. And I just wanted to mention that quickly because I thought that it was helpful and important, and I wanted to highlight these items. I think these will be beneficial resources for counselors too to offer their clients. I have enjoyed learning about disaster mental health and the interventions and approaches that I can apply should I find myself working in that kind of an environment. Even though it is a stressful topic, it is very interesting, and I have been compelled to want to learn more. So I'm excited for the rest of the term. Thank you so much for watching. Bye.